Hi, my name is Savannah Suarez, and my first clinical rotation is with Dr. Gugliotti in a family medicine office. I believe that one of my most important strengths in this clinical rotation is my communication skills. I believe that I can very easily walk into a patient's room and discuss and make them feel comfortable discussing all of their medical care and their questions, comments, concerns, any of that. One of the most important things that I've found thus far in my clinical rotations is how much the patients look to the physician as a source of trust. They trust him with all of their medical care and whatever is going on with their lives, even if it's just like mental health or their complicated diagnosis. So I think that my communication skills will really benefit me in this setting. I also believe that my time management skills will be another great asset and strength to this clinical rotation because it is a very busy office and there are lots of patients that are seen every hour. So I think that being able to go in and safely and effectively assess, diagnose, and collaborate with the physician to treat a patient will be really beneficial so that we don't lose track of time and are able to safely move on to the next patient. So I think that those skills are definitely going to benefit me in this practicum and as a nurse practitioner. One of my weaknesses I would say would be in holistic medicine because I'm not 100% confident about my holistic medicine or about the evidence-based practice surrounding it. I believe that some patients do want more holistic options rather than jumping right to invasive or pharmaceutical treatment. So I think that understanding the evidence-based practice of holistic medicine and understanding what may benefit a patient with a certain disease is very important as well. One of the things that I could work on with that would be to just do more research on it and learn more about holistic medicine and what medications and remedies could work for certain patients with certain diseases. I think with that as well, I would need to learn more about what contraindications with certain medications may arise as well, and that would be another thing that I could collaborate with the physician with. Another weakness that I believe may come in effect is that I'm not 100% confident whenever it comes to diagnosing and treating a patient. For so long, I have just been assessing patients and giving recommendations, but never fully diagnosing and treating. So I think that is something that I need to utilize my preceptor for, and utilizing differentials will really help me. I think that differentials create opportunity to see different diagnoses and where they may fall into with a certain patient. So I think that formulating differentials and collaborating with a physician and regaining confidence would really help me in long term, and I think that would just come with time and being more comfortable in the clinical setting. Another thing that isn't necessarily a strength or a weakness is that I'm still working part-time as well, and I'm working both nights and days, so I think that could be difficult with the clinical schedule as well, especially when working night shift. So I think that just finding the time and creating a good, healthy work-life practicum balance is going to be really important to be successful in my clinical career. Another thing that I think would definitely help me with the confidence and holistic remedies and just being a better student and nurse practitioner overall is definitely utilizing sites like UpToDate or Epocrates or any of those that are going to give me a wide variety of different treatments and different differentials and ways that I can expand my knowledge rather than being so geared towards one diagnosis or another, and especially understanding what to educate patients on if I'm not quite sure with certain medications, and what contraindications that may arise if a patient is taking a certain medication and is already on one medication, or is there drug-to-drug interactions. So I think that utilizing sites like that will definitely help me be a better practitioner and allow me to more effectively collaborate with the physician with all my knowledge already, but just like deepening my knowledge to allow me to have more of the answers. But I am excited for this upcoming semester. So thank you.